really ugly. I suffer with multiple chronic illnesses. I have pain conditions, and I've been denied medication from my doctors because of the insurance influences. Yesterday I paid $800 for 30 Actique suckers just so that I could get out of bed after I spent 2 weeks in bed. I had gotten the suckers for a year, and suddenly insurance denies it, and my doctor's arms are tied. What scared me when I was reading the new healthcare policy is where it says the government will track readmission rates at hospitals and impose penalty fees on hospitals with the highest readmission rates. I want to know how Congress is going to protect me should my chronic illnesses flare up and I come home from the hospital and something goes awry, that I'm not going to be denied admission when the need arises.
Yes, ma'am. I don't know whether, Dr. Gill, you have thought about Dr. Gill?
You know, this is that law of unintended consequences. You know, in their zeal to control cost and somehow measure quality, they're using this readmission test and/or complications test and so forth. The unintended consequence there is that physicians will begin to shy away from the more difficult cases and the more problematic patients, because then they get a bad mark on their record, the hospital gets a bad mark, and then ultimately they have said that if a physician starts getting too many, quote, bad marks, then they're going to start reducing their pay as well. So it's a travesty what's happening. They're trying to measure quality. It's very difficult to quantify it. I think that the medical specialty associations ought to be working hand in hand with the bureaucrats to try to figure out how to best measure quality. It's a very difficult thing to do. But unfortunately, for those with difficult medical problems, their access is going to fall under this plan.
This is one of the frailties of following all the rules that are not drawn for the benefit of the patient. I think the gentleman's recognized.
Thank you, Congressman. As an uneducated political science major from Texas A&M,
Good for you.
and a small business owner and a health insurance agent of over 15 years.
Welcome, sir.
I got a lot on my plate. To keep it simple, I'd like to know the future of health insurance agents in the state of Texas. And in the same breath, please discuss the future distribution channels of health insurance as it applies to this bill.
Yes, sir, thank you very much for your question. I will tell you that I oppose the bill. And I want it repealed and replaced. With that said, it is my hope that we get this done before, or in this cycle in November and in 12. If not, it is very apparent to me that the federal government will establish on a website what is expected of people, that all the people, just like we have seen, that are in the business of providing any sort of loans in housing, most of those have been taken over by the government and moved, as well as anything related to schools where for higher education, where you want to get a loan for student loan, those have been moved to the federal government. These jobs will all move to be federal government jobs. They will not be welcome in the free enterprise system, and there is a strong desire to replace insurance within the government. And so if this thing is not handled very quickly, I think you can see you need to find a new line of business. I thank the gentleman.